Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida. This slide has a lot of information on it, all kinds of symptoms. And what I'm going to be talking about today is actually circadian rhythms. The human body functions through a 24-hour cycle called the circadian rhythm. For instance, every organ of your body, the various tissues, they have a certain time of day where they function maximally, and other times, for instance, at nighttime, many bodily functions kind of go to sleep, like when we go to sleep. And then the main thing that determines the circadian rhythm is actually the dark light cycle. So in other words, when there starts to be light, like at 6 or 7 o'clock in the morning, for instance, your adrenal gland starts producing hormones. So the hormone production of the adrenal gland is supposed to be maximum in the morning and supposed to be minimal at nighttime when the sun starts going down. So this is one of the reasons why with our cell phones, we shouldn't be using them at nighttime, because all that blue light tells our bodies that it's actually morning instead of night. So then our body starts making hormones and different things that keep us up at night. One of the things that affects the circadian rhythm also is cervical instability. Cervical instability can affect this thing right here called the superior cervical ganglion, That ganglion, which is a sympathetic ganglion, basically controls, it's not the only control, but it does control the blood supply to the brain, including a gland called the pineal gland. So the pineal gland is kind of the main gland that is involved with the circadian rhythm of us humans. As we all know, the pineal gland secretes melatonin, and melatonin is extremely important in regulating the circadian rhythm. So when the sun goes down and it gets dark, the pineal gland then wants to make melatonin, and then the melatonin then starts the dark cycle, if it will, and many of our tissues and organs then go to rest. However, when there's a problem with the superior cervical ganglion input, the blood supply to various parts of the brain, including the pineal gland, are not good. When they've done heart rate variability tests on people, they found that the heart rate variabilities are low with people who have problems with the pineal gland and the circadian rhythm. This shows that one of the ways that the circadian rhythm of a person gets off is too much sympathetic tone and too little parasympathetic tone. I believe that the reason why the superior cervical ganglion has too much input is that it's not receiving the inhibitory input by the vagus nerve. The vagus nerve sits right in front of C1. So when a person has C1, C2 instability, and the C2 or C1 vertebrae rotates, it can knock out vagus nerve inputs, including the vagus nerve input to the superior cervical ganglion, which sits right at C2. And then once that happens, then of course a lot of problems occur, as you can see here, but one of the ones that it affects is the circadian rhythm. So if you're somebody who your 24-hour cycle is all screwed up, like you have trouble sleeping, you have insomnia, something isn't right, you're just incredibly fatigued, consider getting an evaluation for upper cervical instability. We document upper cervical instability by a by a scanner called digital motion x-ray. So we actually move the person through various motions after I actually numb the muscles of the neck. This allows us to see the full extent of the instability. And many people have cervical instability and they don't know it. I think one of the main reasons that they have it is that they're using cell phones in the face-down lifestyle, and this causes a stretching of the ligaments in the neck. The good news is all this can be resolved with prolotherapy. Prolotherapy tightens the ligaments, including the ligaments in the upper cervical spine. Once that happens, the functioning of the vagus nerve and superior sympathetic ganglion get back to normal. Blood flow to the brain gets back to normal, and so does the normal dark light cycle that we call the circadian rhythm. But this is all predicated on you not using your cell phone at night. So I'm telling you, don't use your cell phone at night. It screws up your circadian rhythm. So I hope you'll listen to me.